I'm really honored to be here and truly excited about the potential to partner with your organization on this important initiative. And I met Jack only a short while ago, just a few months ago, and I can tell you that he reminded me of one really important fact that never doubt the ability of one person with a team of friends to change the world. So congratulations, Jack, on all you've accomplished in making the world better. Really honored and inspired by your work. So I'm a gastroenterologist by profession. I live in the United States of America, and I really I'm a professor at the University of New Mexico. In 2001, I went to my clinic and I was seeing a patient. She was a 43-year-old woman, um, and she had two children in the room, a 14-year-old boy and a 9-year-old girl. And I asked her, "How can I help you?" And she said, "I have hepatitis C, Dr. Arora. I'd like you to treat me." So I said, "Definitely, I'll do that. How long have you had this disease?" And she said, "I've had it for 8 years." So I asked her, "Why did you not come earlier for treatment?" And she said, "I had called your nurse and she said there was an 8-month wait to see you, and that I would have to drive 200 miles each way from my small town and make 12 trips to come and see you. And I was a single mother. I had a 1-year-old child. I had an old car. I couldn't come 12 times to see you, 200 miles each way. So I decided not to get treatment." So I asked her, "Why did you come today?" And she said, "I'm having pain in here in my right upper side of my abdomen." And I got very concerned about it. I did an ultrasound and she had a cancer of the liver just slightly smaller than a tennis ball. And it was too late for treatment now. We could not do a liver transplant. We could not remove that part of the liver. It was too big. And she passed away. And I asked myself, why did she die in the United States, where I had all the medicines to treat her, all the diagnostic tests were available, she had the insurance required, but she died because the right knowledge didn't exist at the right place at the right time. And without the right knowledge at the right place at the right time, you cannot possibly get the right care at the right place at the right time. And this problem is so existent all over the world, not just in health, but in sanitation, in clean water, in environmental issues, in education. In the world, billions of people suffer every day because they don't have access to the right knowledge that they need. It's not just a shortage of money. It's a shortage of solutions. It's a shortage of ideas. So now the problem I was facing in New Mexico was there were 28,000 patients who had been diagnosed with hepatitis C. And the only 1,500 had been treated, and they were coming to see me. Many were dying of cirrhosis and liver failure. And I was trying to understand, how should I treat all 28,000 patients? Very similar to what Jack is trying to solve. How does he get a toilet to everyone in the world? And so I came up with this model called the ECHO model, which is based on 4 ideas. I said, look, if I can use technology to leverage my expertise and that of my colleagues, in this case, a psychiatrist and a pharmacist, by using one-to-many video conferencing. And in 2003, I started ECHO. The second idea was to share best practices. So I went around the state of New Mexico, very much like Jack went around the world finding partners. And I found 21 new centers of excellence for treating hepatitis C in New Mexico in primary care settings. 5 were in the prisons and 16 were in rural clinics. And I told them, this is my protocol for treating hepatitis C. Can you start treating this disease? Because I can't treat everyone myself. And they said, look, this is too toxic. This is chemotherapy, weekly injections. We can't do this. So I asked myself, how did you become an expert in gastroenterology? So when I was doing my fellowship in Boston and Massachusetts, I would see a patient present to my professor, see another one present to my professor, another one present to my professor. And after 2 years, they started calling me a gastroenterologist. So I said, aha, I'm going to use this same model of iterative guided practice or mentorship to create new experts in hepatitis C in New Mexico. And so every week I started this program where all 21 of these primary care doctors would join me, very much like today we are joining on an interactive video network, and one by one present patients to each other and to me. And we would discuss them. And I found two things which created this principle of echo. That certainly they were learning from me because I was giving them the knowledge. Sometimes I'd give them a lecture. I would tell them how to manage their patients in their local area. But I was learning from them too. And they were learning from each other because each one of them was bringing a case to present. But I was teaching them the theory. They were teaching me what the practical aspects and the barriers were in their local communities. And they were teaching each other. And this created a situation that literally they became total experts in about 1 year. And they became such experts that the wait in my clinic, which was 8 months long, fell to 2 weeks, and everybody in New Mexico got hepatitis C treatment, and tens of thousands of patients got treated. So I said, at that point, I started saying, aha, if I can treat hepatitis C and give chemotherapy in a rural area, I could treat a lot of different diseases. But first I had to do research to show that the model was working. So we started doing research. As I said, I'm a professor, and we were able to show that echo was producing joy of work for these rural clinicians. It was building community through respect and love and empathy, and their self-efficacy was going up, and their results were as good as I was getting at the university. And we published this in the leading medical journal in the world called the New England Journal of Medicine. And this was a game changer for us, because now we had shown that a prison doctor or a rural doctor could give chemotherapy and get the same results as a university professor. So then we started applying it for a variety of disease areas across the world. We said, okay, we can use it for HIV in Africa. We can use it for diabetes in the US, for opioid addiction, for high-risk pregnancy, for early childhood education, for crisis intervention, for rheumatology and rheumatoid arthritis, and many, many diseases. And we said we would democratize our expertise and give this expertise of doing echo to anyone in the world who wanted to share their knowledge with other people for human good. We would teach them to do echo, but we would also give them our technology platform so that they could, and we would do all of this for free. We set ourselves a goal that by December 31st, 2025, we would help 1 billion people. In order to do that, we started training first the major universities in the world. We first trained University of Washington, then University of Chicago, then Harvard, then Yale, then MD Anderson in Texas, and Johns Hopkins, and so on and so forth, until we had trained about 250 of them to launch echoes. And then globally, we started launching echoes in India and different parts of the world for different disease areas. And currently, we have about 1,000 networks operating in the world. We have there for about 100 different disease areas, but we also have 25 networks now in the field of education, where we train school teachers to be better school teachers. And we have echoes in water security and other kinds of issues. And we also have echoes in law. This is where you can see, I'm going to show you just a few slides to show you. In 2005, we went to Africa with the idea that there were, the US government asked us to go there. There were 200,000 patients in Namibia. We needed to get them on HIV treatment. And you can see here, these are all the district hospitals in Namibia joining and learning on echo and hundreds of thousands of patients got treated. This is Vietnam for multi-drug resistant TB echo, India multi-drug resistant TB echo. And we started, Africa is the most underserved area for healthcare services. So we focus there. And we now have 28 programs, 5 hubs out of Kenya, 5 after Tanzania, 2 out of Uganda, etc. And we partnered with the Africa Union and Africa CDC to launch ECHOs in 40 countries in the southern, central, eastern, and connecting regions. And it has been growing rather rapidly, ECHO, in the sense that now we have hubs in 44 countries. We have learners in 165 countries in the world. Our second biggest operation for ECHO is in India, where we have a team of 120 full-time people who are working with us. And we have another 150 in the US working on this project with the idea of democratizing knowledge for human good. We also have 290 peer-reviewed publications on why ECHO works. And overall in 2019, we had 237,000 learners, but in 2020 now, 750,000 learners in these 165 countries are being mentored on ECHO. So what really makes ECHO work, before I come to how it can be used in the World Toilet Organization, is team-based care. Task shifting is the idea of every human being working at the highest level of his human potential. And that requires interprofessional consultation, many experts helping you, guided practice, and mentor-mentee relationship. So scaling up human work requires human beings to mentor each other and guide them through guided practice. ECHO is also a community of practice. It's a social network that produces joy of work. Technology reduces the cost of collaboration. Force multiplication is the idea of expanding the capacity to do any best practice 10 times or more. I talked about all teach, all learn. And nobody exemplifies the idea of demonopolizing knowledge better than Jack Sim. I think he's the model. I thought I had invented this word, but when I met Jack a few months ago, I realized that I was following in his footsteps of sharing everything he had learned. So ECHO is a movement like the World Toilet Organization, and we are joining the movement, and we want to support the WTO. So let me spend the last few minutes on telling you how the WTO can use ECHO technology to potentially make a big difference. So first of all, the technology can help the entire movement come together, which we would of course provide at no cost to WTO to use to any extent that you want. So champions like Jack Sim in the other parts of the world can come together to exchange ideas. That's one. Second is to share resources, which could be policy materials, communication packages, films. There can be also laws that have been passed in one country, as Jack was talking about, laws for bigger toilets for women than men. Even in the United States right now, when I'm at an airport, there are more lines outside the women's bathroom than there are outside the men's bathrooms. And that needs to change. And we can share all these best practices amongst the different parts. The second thing we could do is, in each country which is interested in joining the WTO and working, we could put separate ECHO hubs there for them, those experts, to democratize their knowledge in their local community. Lastly, ECHO has been used around the world for the purposes of advocacy, where we can use the model to train advocates in different countries, not for the purpose of building toilets, which certainly is an opportunity to do that, but how to advocate for toilets, how to advocate for sanitation, how to advocate for new laws and policies. And in many, many disease areas around the world, ECHO is being used for advocacy. These are ECHOs just for the purpose of building advocates in local communities. And as a result of some of this work, we have introduced many laws in the United States now. And I am so excited about this opportunity for ECHO to partner with the WTO and assist you in any way we can to further your mission. I think that there is no better health mission than producing sanitation, clean toilets, clean water for humanity. And thank you, Jack, for your leadership, and thank you for including ECHO in your larger vision.
Thank you very much for your support, and we are taking up your offer to do this ECHO collaboration model so everyone can continuously share their expertise. Thank you so much.
Thank you, Dr. Arora, for taking us through such a wonderful presentation. ECHO is definitely a good platform to collaborate and provide solutions at a mass scale.